Hello everyone. Now I'll be discussing question on cardiology. So we have a 54-year-old man and he has 2 weeks of shortness of breath. He get out of breath easily when walking even for a short distance. In the night dry cough is there. He has hypertension for 3 years ago but does not take any medication. At the moment BP is 162/90. Pulse 98, JVP is raised, pitting edema is there, bilateral basal crackles are there. Well, you very easily you make a clinical diagnosis of congestive heart failure. Very simple. All these are the classical feature of CHF. And if you so far analyze it, he is having hypertension for last 3 years and not taking any medication. This very obviously these symptoms are due to congestive heart failure. The signs are of heart failure. So now at least picture is very clear that the patient has hypertension and which is causing congestive heart failure. Well, we already have concluded that, and it is given the question also that is the case of CHF. What is the greatest sensitivity for diagnosing heart failure in this patient? The answer is elevated brain natriuretic peptide, what we write as BNP level. Why this, why not others? Let's go to the details. Well, patient has untreated hypertension, the point I mentioned, and now he has progressive dyspnea with a night cough, which is concerning for congestive heart failure. Point to be noted, they are suggestive that we are dealing with night cough. Now, just to add on to you, other important conditions which can lead to night cough are GERD, gastroesophageal reflux disease, and bronchial asthma. There are the two other important conditions which can lead to night cough. Okay. Now, BNP, it is a natriuretic peptide. That means this is one hormone which causes increased excretion of sodium in the urine. That is why we call it natriuretic hormone. And elevated level of BNP is very highly sensitive. Sensitivity is more than 90% to diagnose the case of congestive heart failure. Okay, now I tell you, classically written in all the books, if you are getting any patient of congestive heart failure, you are thinking clinically that he is a case of CHF. But if the patient ECG is normal and BNP level are normal, if these are normal, then it is unlikely to be a case of congestive heart failure. Now you can see how much importance has been given to BNP. Raised BNP is a diagnostic tool for congestive heart failure. But I have again stopped the video. I have one more question for you. Write down the answer in your copy. BNP is released from which place in the body? Well, the answer is they are released from ventricle myocyte in patient with congestive heart failure. And this is in response to high ventricle filling pressure, which is there in a case of congestive heart failure. Now, elevated level of circulating BNP, they correlate with the severity of LV dysfunction. They are useful in differentiating CHF from other cause of dyspnea. As I mentioned previously also, if the BNP level is normal and ECG is normal, then perhaps you are not dealing with congestive heart failure. Now, in studies of patients presenting with acute dyspnea, which is a classical finding can which occur in severe left ventricle failure, if normally the BNP level is more than 400 picogram per ml, and less than 100 is a high negative predictive value for CHF for a cause of dyspnea. So the values are low, that means you should search for any non-cardiac condition of dyspnea. Well, as far as the answer is very clear that BNP is the most important sensitive. Now, other options are crackles, cardiomegaly, JUP. Okay, they have a high specific signs like bilateral lung crackles, raised JUP, and third sound. They all are specific, but they are not that they are not absolute diagnostic that we are dealing, because this a third sound is a very important sign of CHF, but it can occur in so many. Rather, it can occur normally in children, pregnancy, athletes. Okay, so they are S3 there is strongly suggestive of CHF, but it's not that it will in all cases of CHF or all S3 cases are CHF, not like that. JVP race is a feature of right heart failure. But now one more question for you. Stop the video, write down the answer. Tell me any condition you know of where you get non-pulsatile raised JVP. Write down the answer quickly in your copy. Well, the answer is superior vena cava obstruction. Lung crackles, they can occur in so many conditions. It can occur in pneumonias also. Okay, so this again, they are not diagnostic of congestive heart failure. So their sensitivity is low, therefore absence should not exclude congestive heart failure. Cardiomegaly on chest X-ray again low sensitivity, only 60%, they are not a diagnostic investigation for CHF. If you look into other options, elevated plasma renin activity is a marker of reaction activation of renin-angiotensin system. It has no role in diagnosis of congestive heart failure. Now, it's simple. Again, stop the video, write down the answer. Tell me any direct renin inhibitor drug. The answer is aliskiren. It's a drug that we use in hypertension. So, golden line to remember, elevated plasma BNP level have a high sensitivity to diagnose a case of congestive heart failure. The clinical signs of heart failure, bilateral lung crackles, raised JVP, lower extremity edema, third sound, they have high specificity but low sensitivity to diagnose a case of congestive heart failure. Thank you very much.